Hello, I'm Dr. Kim Young-kyun at K Oral and Maxillofacial Surgery Clinic. Today, I will introduce a paper published in Korean academic journals. I believe that for clinicians practicing in Korea, clinical tips presented in papers and dental news articles in domestic journals and magazines can be very useful in daily practice. Looking into these articles can provide highly valuable tips for clinical practice. Many of you likely perform sinus membrane elevation often. Even experienced surgeons have likely encountered accidental maxillary sinus membrane perforations during surgery. So, you want to know how to deal with such cases. The paper I will be presenting today focuses on how to treat perforations of the maxillary sinus membrane. Among the complications that can occur during sinus membrane elevation, membrane perforation is by far the most common. The reported incidence varies widely, ranging from 14% to 56%. If a perforation occurs during surgery, the risk of secondary complications such as infection or loss of graft material increases. However, the perforation itself does not have a direct negative impact on bone graft procedure or implant survival rate. The key is to identify the perforation early and close it effectively using various techniques. Therefore, understanding various closure methods is essential. This study focuses on clinical outcomes of using a collagen membrane to repair large perforations of the maxillary sinus membrane. Now let's take a look at the study's methodology. In the cases where a large perforation occurred during sinus membrane elevation using the lateral window approach, the perforated area was completely sealed using a resorbable collagen membrane, followed by bone grafting procedure. And at the same time, the implant was placed. Afterwards, the study evaluated postoperative complications including peri-implant marginal bone loss and the resorption amount of grafted materials in the maxillary sinus. The study included a total of 13 patients. According to the results, the average amount of resorption of the grafted materials in the sinus was approximately 4 mm at the final follow-up. It is presumed that, although the large perforations had to be closed, some degree of graft material loss occurred, which may have contributed to the relatively greater resorption. Both the primary and secondary stability of the placed implants were excellent. At the final follow-up, the implant survival rate was 100%. Given the excellent primary and secondary stability and the successful osseointegration observed, I believe that as long as large perforations of the maxillary sinus membrane are successfully closed, they may not have a significant impact on implant failure. The following postoperative complications were observed in this study, and all were successfully resolved. Maxillary sinusitis occurred in 4 cases, but they were effectively treated based on standard infection control principles. While prevention of complications is always the most important goal, this study suggests that even when complications do occur, most of them can be resolved without major issues if managed properly. To summarize, even in the case where a large perforation occurs during sinus membrane elevation, stable clinical outcomes can be achieved if the perforation is properly closed using materials such as a collagen membrane. Today, we reviewed the repair process of sinus membrane perforations, specifically focusing on the clinical outcomes when using collagen membranes. That concludes today's presentation. There are still many valuable papers I look forward to sharing with you. I will be back with another informative topic. Thank you.